Hi, I'm State Representative Andy Schor, and I'm proud to serve the citizens of Lansing and Lansing Township in the 68th House District. This is a special report about a very important new initiative to promote healthy lifestyles and wellness in Ingham County. My two guests today will tell us everything we need to know. Valerie Glesnes-Anderson is the Executive Director of the Capital Area Health Alliance, or CAHA, and Dr. Renee Canady is the Director of the Ingham County Health Department and the Health Officer for the county, and a good friend. Thank you both for being here. Would you like to start off? Let's talk about the Choosing Health program. What can you tell the viewers?
Basically, the Capital Area Health Alliance has had a program associated with healthy lifestyles for about the last 12 to 14 years. And recently, well, not that recently, but in about 2007, we decided to tick it up a little bit and really bring in area organizational leaders to get involved in a process that we called creating a culture of healthy lifestyles. We had a symposium to discuss that, and our first speaker for that first meeting was Renee Canady before she even was at the health department. So we were really pleased that she was our keynote speaker. And the process of creating a culture of healthy lifestyles at that point involved a lot of organizational leaders, and there's over 90 organizations that participate in this process. But we wanted to reach out more to the community, and so we went through a process of coming up with a brand that would reach people and not be as heavy as creating a culture of healthy lifestyles, and that brand is Choosing Health. So Choosing Health was the vehicle that we used to apply for a grant for the state to be the vehicle for them in this region to promote their 4x4 tool. And the 4x4 tool basically is a process to have you know 4 things and do 4 things. You're supposed to know your blood pressure, you're supposed to know your cholesterol level, you're supposed to know your body mass index and your blood sugar. And then the 4 things that you're supposed to do are to eat well, have a healthy diet, get some exercise, have an annual physical, and avoid tobacco use. And so the state is trying to help our citizens understand that those 4 things could make a major impact on your overall health. And we, working with the Ingham County Health Department, applied for a grant to receive the money to promote that tool, and we're working together to get that done.
Let's talk about that for a minute. Dr. Canady, how's the health department partnering in this effort?
Well, I must say first that I just absolutely love the title that our community came up with, Choosing Health, because we live in a society, in a nation where we value choice. Choice is important. And to recognize, one, that many of us don't have good choices, and secondly, that many of us don't have the support to make good choices. So when this community came together and said, well, we do want a culture of health, but how do we sort of market that and brand that so that people say, I want to do this, as opposed to, you can't make me do this, eat your vegetables. We want it to be their choice. And the fact that we said choosing health is an acknowledgement that we need to come together and do better. We've not chosen health yet. We're not looking back on it, but we're trying to come together and collectively say, we're choosing health so that we can be healthier, our kids can be healthier, our communities can be healthier. And that's really where the health department came in. I mean, we have always had a history in this particular county and the region of not just doing the work in an insular sort of way. We have very knowledgeable health educators, very knowledgeable nurses and health analysts, but we've always said, how do we serve as a resource to the community? So when CAHA approached us and Valerie said, hey, would you consider partnering with us on this endeavor, we were absolutely in favor. So what we tend to try to do is to provide technical support and assistance while they're engaging the community and helping us allow the community to be the driver.
That sounds great. Now, I understand there's some kind of a rally on June 8th, something that we definitely need to share with the viewers. So why don't you talk a little bit about what's going on?
Well, basically, the grant has 3 parts. One is to reach leadership. The other is to reach organizations and have them get involved with policies, to make health more available. And then the third is to reach the community at large. And so the June 8th event is to reach the community at large, to have them come to get involved with area resources. There'll be over 30 different organizations, including the health department, that will come and show resources that are available either at low or no cost, so that people can have aids, helps, encouragements in choosing their healthy lifestyle. And the kickoff for this presentation and for this event will be Dr. Canady. She'll get us all going.
It's the old cheerleader in me. It comes out every now and then. I think, having gone to one of the CAHA rallies in the past, that if you don't come, if the community doesn't come, they are going to hear about this in the media and they're going to say, wow, I wish I had been there. I mean, last year, even as I was participating, I was sitting there going, man, I should have called so-and-so to come, and I should have called so-and-so. There was such an energy and a sense of hope to say, you know, I know our statistics look bad right now, but we can do something about it. You know, in the greater Lansing Tri-County area, over half, almost half of adults are either obese or overweight. That's so unacceptable, that we can do better together. There are people, if you look at our statistics on how many people get the recommended fruit and vegetable allocation in their diet, only 1 out of 5 adults. There are things that we need to choose to do better together. And sometimes, you know, fast foods, and no criticism of fast food because many of them are working to have healthier options, but we're sort of a convenience society. And somehow or another, we've got to come together to say, how do we make health the easy choice? And this is what we're going to do at that rally. To say it's not as hard as you might think it is to come together and decide as a family, as friends, as colleagues even, to be healthy.
Right. There'll also be active demonstrations where folks will be showing people how they can cook snacks, meals that are healthier, lighter, and enjoyable. You know, I think people have a bad conception of what it takes to live a healthy lifestyle, but it's nothing that's difficult or impossible or unavailable. It's something that we need to be oriented toward. And I think that's what Choosing Health is all about.
So people are going to come away from this with pamphlets and booklets and seeing how things are done and where they can get their food and all of the resources they need.
Right, right. It's going to be a resource opportunity. It's also going to be an educational opportunity. And then the other thing that we're doing, which we're trying to be sensitive to, is we want families to come. And so there'll be some wonderful places for kids. We'll have some carnival games. The City of Lansing Parks and Rec is going to come and bring their carnival games as well as their camp games. And then Lansing Community College is going to have a demonstration of jump roping and different things that could be done with jump ropes. And all of this is going to be at St. Joseph's Tabernacle Church and at the Armory. And CATA is providing free transportation. So what's really exciting, and the dynamic that Renee is describing, is the fact that all these different organizations have come together to try and make this something to enable the community to do better in their healthy lifestyles.
We've all been in communities where you drive through and you just say, wow, look at all the people exercising or walking or running, jogging. Look at all the people in the park. That's the community we want. When visitors come, we want them immediately to notice how easy it would be to take this bike path or to take this sidewalk, to jog to work or to ride your bike to work. We want to become that community by choosing health together.
I think I fall not in the one of 5 people who are able to do all those fruits and vegetables, and I know it's challenging as a parent to have your children maybe picky eaters, or if maybe you don't have time. So I'm glad that there will be resources provided for parents, for families. What are some of the other big health and wellness challenges that we're facing here in the county?
Do you want to talk about smoking?
Well, we have some issues associated with tobacco, and there are still folks in this region who engage in a lot of cigarette smoking. One of the things that we're encouraging parks to do is to actually get involved in not smoking in the parks. And that's innovative, it's different, and it's also exciting And it presents a chance for people to not be around smoke when they're out to get recreation. So it avoids secondhand smoke. It also presents something wonderful for the parks folks because it costs less money to keep a park clean if you don't have to worry about cigarette butts. So right now, Eaton County Parks has implemented a process of having smoke-free parks. And we're trying to explore and encourage other communities to do that as well.
We've learned through surveys of smokers that about 70% of people who smoke state that they would rather not smoke. And so how do we begin to set environments where if you're trying to stop smoking, it's easier because you're not confronted with smoking as you try to increase your exercise and activities in the park. So it's an important first step for this region. I think it's exciting as well as innovative.
Great, great. Well, how can folks learn more about the Choosing Health campaign and discover health and wellness opportunities in our community and any other communities?
There are, the Capital Area Health Alliance has a website, capitalareahealthalliance.org. There are also Facebook pages. There's a Choosing Health website. There's a Choosing Health Facebook page. And then all that other information associated with the health of this community is also available from the Ingham County Health Department. And there is a major report called Healthy Capital Counties, which actually gets down to the analytics associated with the things that we've been discussing.
I think the important thing about the Healthy Capital Counties report, and thank you, Val, for bringing that up, is that is the result of a broad partnership of local health departments in this tri-county area, as well as key hospital partners. And so when you have McLaren and St. Lawrence and Hayes Green Beach and Eaton Rapids Hospital come together with the Ingham County Health Department, Barry Eaton Health Department, Mid-Michigan, you're talking about your key health advocating agencies coming together to say to the community, how can we work together to improve our health? So that's extremely exciting. And yes, there is the wonderful report, and we'll now be working within our organizations as well as with the community to say, okay, child health, you told us, was an important priority. What do you want us to do together to improve that?
Unfortunately, we're out of time. This has been a special report on Choosing Health and the Michigan 4x4 campaign to promote healthy lifestyles for Ingham County residents. As your state representative here in Lansing and Lansing Township, I encourage you to contact my office if you have any questions or concerns about this or any other state government issue. Thank you to both of my guests, Valerie Glesnes-Anderson from the Capital Area Health Alliance and Dr. Renee Canady from the Ingham County Health Department. Thank you again for watching.